4,200 million, 4.2 billion in 2004. And this kind of began when the HMOs began to pay for the drugs. And so now there are a lot of people have pharmaceutical insurance, drug insurance, and they just whip out their credit card and it's like, okay, I'm going to get the most expensive because it doesn't really cost me anything. And so again, this is based upon kind of an emotional idea that if it costs more, it must be better. But it's not always based upon the evidence. And unfortunately, the drug companies tie into this by providing education, which is not always correct. For example, the most glaring example was the whole Vioxx tragedy, that in 2000, Merck spent more on it than any other drug product ever before given to the public. They spent $161 million. That budget exceeded the advertising budget of both Budweiser beer and Pepsi Pop in 2000. And yet, the drug companies say their high prices are due to research and development, even though in reality, when you look at the numbers, they're actually spending most of their money on marketing. Now, the next sad thing about Vioxx is that what they were saying was not true. They knew it, and the FDA also knew it, that Vioxx was actually more dangerous than Aleve, which is an over-the-counter product, which you can now get generic over-the-counter. Vioxx was supposed to protect the stomach, but in reality, there were more cardiovascular side effects, deaths, complications, than there were GI complications prevented. It was no more effective than Aleve, and it costed 10 to 20 times more than Aleve. So what Merck did was they used advertising to create a need for something that was ungrounded. Now, these are not just my observations. There's really a very good book I wanted to promote tonight, written by a family physician who I admire because he took 2 years off from his practice in order to write about these very deep concerns that he had about the problem of the way science was being misused in an effort to market. And so this is called Overdosed America. And here he actually had an example of where, after spending 2 years researching this and being very thoroughly aware of what was going on, he went back into practice, and one of his patients came in and asked him for a prescription of Vioxx. And he said, hey, I've done research on this. This is really not in your best interest. It's dangerous. The patient did not believe him. The patient believed the television ad more than they believed their own doctor, which to me is a very good sign of the corrosion of the doctor-patient relationship. So this, and then doctors themselves put a lot more trust in this information gained from the ads from journals because they prescribed over $7 billion worth of Vioxx, which resulted in 100,000 heart attacks and death after it was already known that Vioxx was no more effective than Aleve, 10 to 20 times more expensive, and could cause heart attacks and deaths. So this is really just part of what's going on. What is hidden from the average consumer is that drug companies have placed profit over proven effectiveness, safety, and truth. And if you don't remember anything else of what I say tonight, this sounds pretty bad, but I'm going to go ahead and say it anyway. The drug companies are no more responsible for our health now than the fast food industry is responsible for the quality of our diet. So both industries, though, try to promote that they're very concerned about your health and they want to do the best. And I'm sure they are doing things, but I think part of this is based upon the fact that we are so heavily dependent upon the market system here in the United States when we're really the only industrialized country that, when it comes to healthcare, that is that way. We're the only industrialized country that does not have universal health care. We're the only, along with New Zealand, country that allows direct-to-consumer drug ads. And we're the only country where the drug companies can charge exactly what they want. And this chart that's on the second page showing healthy life expectancy per person healthcare cost, you can see we are #1 in the world when it comes to healthcare costs, way above other countries. But the healthy life expectancy, we're down there kind of with the Czech Republic, whereas places where, like Japan and Sweden, they have a much lower cost, but a much higher life expectancy. So we like to think we have the best healthcare system in the world, but in reality we have the most expensive, 15% of our gross domestic product, compared to 8% in Japan, England, Spain, and New Zealand. But in spite of that, we do not measure up when it comes to life expectancy and infant mortality. So why isn't this happening? Why aren't we getting the best scientific knowledge into the exam room where the doctor is actually teaching the patient about how to be healthier or how to get well if they're sick? Well, again, it does not serve the commercial interest. So I'm saying we need to really get back where doctors are true teachers and healthcare educators and providers. Now, that's going to be a long way to go because that's not what's being taught in the medical schools. And I think the American people needs to stand up against drug commercialism, and we need to have a cost-effective medical care system that's focused on improving health most efficiently, safely, and professionally. So what can you do? Well, just remember that most of your health comes from your lifestyle choices. It's the little day-to-day choices that you make on a regular basis that's going to have the greatest impact on your health. 70% of preventable deaths have to do with lifestyle. And the problem with the direct-to-consumer drug ads is that it makes it seem like if we just get our cholesterol down, that's all we really need to do. And it's taking our attention away from learning about how we can promote wellness in our lives and our families and in our businesses. So I've got a couple other examples here. You know, the statins are probably the most promoted of all the drugs, and yet they do help high-risk patients, there's no doubt. But there's no evidence that women without heart disease can benefit from them, no evidence that people over 65 can benefit from them. As a matter of fact, people 70 to 82 who have been on statins for greater than 4 years have a 25% greater chance of developing cancer. There was 2,000 women who had high blood pressure and 3 other risk factors. Half were put on a statin and half got a placebo. The statin group developed 10% more heart attacks, and yet the national guidelines say that if your LDL is over 100, you need to be put on a statin. Unfortunately, 90% of the panelists who were on that committee that developed those guidelines had conflicts of interest, known conflicts of interest. So what we see happening right now is that more and more conditions now are requiring lifelong treatment with drugs. For example, high cholesterol and blood pressure, which we now know is a Syndrome X problem that deals directly with exercise, lifestyle, diet, those kind of things. Osteopenia and osteoporosis, what used to be just aging bones, now it's become a disease that requires lifelong treatment. Depression and mental illness, a lot of patients when they get on an antidepressant, they're pretty much on it for the long haul. We've converted shyness into a disease that requires a drug. The change of life, that's requiring hormones for the rest of your life. Even something like PMS has now got a fancy name, premenopausal dysphoric disorder, and there's a medicine for that too. And I've renamed erectile dysfunction the sports spectator syndrome because every game you see now is sponsored by Viagra or whatever. You know, so there's a good reason for that. Don't go into that. So all the results of this, the results of this is that we're not looking at what we can do. We're just looking at the quick fix, but it's a very expensive fix. And so I really think we need to make health education a national priority. We need to create a drug company independent medical board that reorients medical research to health. We need to have non-drug alternatives in terms of the clinical guidelines, not so much emphasis on just the medications. We need